So I'm here interviewing Dr. Leslie Craig, a reproductive psychiatrist. Dr. Craig, can you help everybody understand what a reproductive psychiatrist is?
Sure. It's a fairly new subspecialty in psychiatry. It's basically a women's subspecialty, and we deal with anything that's sort of at the boundary between OBGYN and psychiatry.
Wow.
So for me, I do anything from PMS, PMDD, pregnancy, postpartum, infertility, all the way to menopause. There are some people that only do perinatal psychiatry, just things around birth, but it is a very gratifying specialty. I have loved doing it, and I'm happy to say I'm probably one of the grandmas of the field at this point. There are many, many now.
Wow.
Yeah, it's thrilling.
Okay. So what are some of the trends that you've seen over time in your field?
Well, when I first came to San Diego and set up my practice, I was the only one doing what I do.
Okay.
And so women were really just thrilled to find me and to find out that there was a specialty just for them for these issues, because they had felt misunderstood and like there just wasn't anyone they could really see who, captured all of their worries and concerns and so forth. Since I did that in 1998, there have been many more reproductive psychiatrists come into town, and they are training a few. There's no official residency yet, but there's a program at UCSD where they have graduated a few residents with this sort of area of interest or concentration.
Okay.
And so it's really neat. It's really nice to have colleagues.
Yeah, I can only imagine.
Yes.
And you stated when we were chatting a little bit earlier that you were one of the founding members of the Postpartum Health Alliance.
That's correct.
And what is the Postpartum Health Alliance?
The Postpartum Health Alliance is a nonprofit, a lot like Miracle Babies, that's dedicated to raising awareness of and then providing resources for women with postpartum mental health issues. Okay, and we are sort of a branch of Postpartum Support International, which is the international organization that does the same. And so I had met the person who started Postpartum Support International. I met her in 1987 at a conference. And then when I moved here and met others that were interested in doing this, we invited her to come down and help us. And she did.
Wow.
Yes.
Okay.
So we're very grateful to her. Jane Honigman is her name. I should say her name.
Yes, Jane Honigman. Yes.
Yeah.
So if there's a mother or somebody that is recognizing that there might be some perinatal mood or anxiety disorders happening, they can look up the Postpartum Health Alliance and find a provider.
Exactly.
Maybe another reproductive psychiatrist.
Yes, there are several on there now, in addition to, pelvic floor therapists and psychologists, LCSWs, support groups, it's all kinds of stuff. There's even a guy that specializes in dads.
Yes, that's wonderful.
Dr. Danny Singley,
Yeah.
Yeah.
So with your specialty, what are some of the common fears that you see for mothers that are coming in around medication or around getting help for their issues?
Well, I think women have a lot of fears, and they've probably changed over the years, but there's always some hesitation about seeing a mental health professional if they've never seen one before. There's a bit of stigma attached, and it just really changes how people see themselves if they think that they have something related to a mental illness. And so there's a lot of kind of adjustment and comforting that I have to do. And then there's a lot of questions about the safety of using medications in these situations, the safety for mother, the safety for baby, safety in breastfeeding, because ideally you'd like to use the same agent all the way through.
From pregnancy all the way
through to breastfeeding. So, there's a lot of that. I would say over the years it's changed in that it is just more visual and more acceptable. After a few different celebrities have come out with books. Brooke Shields is one. There are many others that have written about their own postpartum experiences. Marie Osmond is another one. I think that helped. But I think women now realize that there is something out there for them, and or women tell each other, if you have trouble, do this, you know.
And there are some that are safe while pregnant or breastfeeding.
Yes,
right?
yes. Now, safe being a relative term.
Okay. Sure. Okay. But I know that for some women that are really suffering, if it becomes something that their mental health will impact their ability to live, then clearly,
yeah, that's an emergency.
Yes.
Yeah.
And so the taking medication is more important at that point to save the mom's life.
Absolutely.
Than to be suffering so dramatically down the line.
Absolutely. But, or even if it's to improve mom's comfort and her ability to function are really good reasons too.
I think I've heard from Postpartum Health Alliance they want moms to thrive, not just survive.
Exactly.
Right?
Exactly.
What do you think is one of the most important things for a mom to know if she is suffering about getting help, especially when there maybe are other people in her life that are not as understanding about mental illness and what that means?
Well, I would say it's that she's not alone. That is the motto of Postpartum Support International. You're not alone. There are women, you probably know women who have had this problem and they just haven't told you, or there may be women in your family who have had this problem and it just hasn't been shared, because it is common enough that it's around.
Yes. And have you seen there is a lack of service providers in terms of a lot of them are full and there's a wait?
Yeah, that can happen. I think we ran into that problem during COVID. We had all-time levels of referrals and old patients returning, and you know, most mental health providers were really overwhelmed, especially the first year of COVID. I know I was.
Yes. Okay. So you did see a big change during the pandemic.
Absolutely. In so many ways.
Okay. Well, Miracle Babies is now starting their perinatal mental health program.
I know. It's
called
wonderful.
My Brain, My Baby. And we will be providing short-term therapy for moms during their high-risk pregnancies, totally free of service, regardless of insurance.
This couldn't be a better idea.
Oh, good.
That's great.
Well, thank you so much for your time and for
my pleasure
sharing the important message of how we need to address women's maternal mental health.
We absolutely do.